So with 2A and 2B, you're going to position the patient a little bit differently. So let me have you in a diagonal. So let me have your feet there and over here. So what you want, okay, you want to slide down a little bit more? Okay, good. And slide here. So you want her shoulder, a little bit off the edge, because now I'm going to use my leg to depress the shoulder blade here. All right. With the upper limb tension 1, again, try to use your leg and your body. So when you start, try to have the elbow right on the inside of your leg. So that frees up your arms to kind of stabilize and move, rather than trying to do it like this. Okay. That way, she's relaxed, I have good control, and I'm using my body. Okay? All right. So again, starting kind of in with her elbow flexion, neutral position, establishing resting symptoms. Now depressing, just putting a little bit of a depression on the scapula. You doing okay? Yeah. Okay. So I'm going to grab her elbow, and now I'm going to let her elbow extend with her forearm in a neutral, kind of neutral anatomical position. How are you doing there? Doing all right? Okay. Now I'm going to laterally rotate her entire upper extremity. And the way I'm going to do that is I'm going to move my right arm past, going to stabilize, going to keep her in elbow extension, but I'm going to come with my right arm. I'm going to take kind of the radial styloid process and laterally rotate her arm. How you doing?
Fine.
Doing okay? All right. So the rotation includes the shoulder and the forearms, and the forearm is in supination, lateral rotation. Okay? And I'm going to extend the wrist. I need you a little bit more towards me. Yeah. So there, I'm going to extend the wrist. You doing okay?
Yeah.
Yeah. And then I'm going to take her into shoulder abduction. How you doing?
Okay.
Doing all right? Any problem there?
Just getting worse.
Getting worse. Okay. All right, so you establish her symptoms, and then you do the same thing of lateral flexion away and towards, looking for an increase or a decrease in symptoms. So once again, so start her into elbow flexion. You're going to depress the scapula, take her into elbow extension, and I'm going to switch my hands. I'm going to take her into lateral rotation of her shoulder and forearm supination. So I'm going to hold that, take her into extension, doing okay, and coming out. So each time, I really want to be asking the symptoms as I add each component. Okay.
Do we just come out a little bit like that, or is it just because she has tension? Would we come out further with someone else?
Yeah, okay. Yeah. You may even stop with someone just going here, and they may say, that's my pain. So they may say it hurts, but then you want to ask them, is that your pain? Because that's what you're really looking for. So you may stop at any one step once you provoke it. And then once you provoke it, wherever the pain may be, you decide, are you going to add more of the distal component here to increase it, or there to make a change? So if she had shoulder pain, I could use the wrist, or I could use the head, either one. If she had more elbow pain, probably use the head more. Okay.
What's the cap? 90 degrees? It should be.
What do you mean?
If you move
in terms
that
of
arm out,
arm out?
no pain. Hit 90
Yeah.
is fine.
Yeah, I mean, if they have a problem and it's affecting the tension, I don't know what the cap is. I mean, you'll first do their non-involved and kind of get a sense of what their normal is. And so, you're going to create some symptoms probably, but in terms of the non-involved side. But if it's involved, you should get something a lot sooner. Okay. You may not even have to go further into the examination. Do you want me to do that one more time? Yeah? All right.
Just a quick question. Is it just wrist extension, or do you add finger to it, or does it not matter?
Yeah, I would add
Finger.
wrist and finger. Yeah, because there is a big difference compared to adding fingers and not.
Okay.
So yeah, I'll write that down. So you want wrist and finger, and then taking them out. Okay? So depress the scapula, extend the elbow, and switch hands, and take her into lateral rotation and forearm supination. Doing okay?
Mhm.
And then take her into wrist and finger extension. Any increase?
A little.
A little bit. And then taking her out into abduction. So I really want to maintain that elbow extension. If I let it up, it's going to change. Okay, so you really, that's the difficulty with all these tests is the minute you let up one component, or if I let up depression on the shoulder blade, it's going to change the test. So that's the hard part of it, being consistent when you reassess. Okay, so be nice. You okay?
Yeah.
Don't crank and depress really hard unless you want to be mean to your